Hello everybody, I want to talk about something really specific today and it may or may not be any use to you in particular, but you may know somebody that has gone through this. So this is radiation-induced fibrosis and this affects or can affect people who've had radiation therapy for cancer. Various different cancers, no matter where they are in the body, can have a latent effect. So that means that soon after you feel absolutely fine and there's no problem in terms of mobility of the joint or the muscles surrounding the area that's been radiated. But afterwards, so a latent response, so it can happen months later, you might get some stiffness within that joint area or within the joints and over the muscles as well, because they can become a little bit fibrotic. And that can happen over months and months and months. It could be almost up to a year sometimes that people think that they've got something additional happening, but it's actually fibrosis of the area that's been radiated or part of the area that's been radiated. That can then offer up some secondary issues, so you can end up with other problems within the joints and the muscles as well, because perhaps your range of motion throughout that joint isn't what you would like it to be, and therefore you might have impingements or bursitis or different things going on as well. So it can be multifaceted, which is particularly cruel because you've kind of already gone through probably the cancer surgery, you've already gone through the radiotherapy, and you think everything's kind of okay, you've kind of got over that hump. But then sometimes this can come back and create a bit of an issue. So it's really important that you get on this if this is affecting you. Obviously speak to your medical team within the NHS or within private practice, whoever's looking after you. But really I'm here to explain what our role is as physiotherapists, and what can happen is that you can have intensive physiotherapy that can help to break down that fibrosis, normalise the tissues within the muscles, lengthen them out, make them feel that they are normal tissues again. We can even sometimes use acupuncture for this as well, so it kind of works on almost like the proprioception and the nervous system in terms of your brain understanding what's going on in that area. A lot of hands-on therapy though, and very specific exercises, and sometimes that might mean that we're coming all the way back to basics, which can be a little bit boring, especially if we've got athletes on board, which we have a lot of. But it is sometimes about reining it in and then just gradually increasing exercises so that we've got a full range before we then go and start doing our strength and conditioning work. So it's quite a specific thing. It's not really something that people talk about, although I wish they did. People are talking about cancer more, which is great, but they often don't talk about the problems related to cancer. And this is a big one, and quite often people think they've gone back to the gym and or back to activity and they've injured themselves. They might have done, which is again why you need to see a physio to try and work that out, what is going on. But quite often, if you've had radiotherapy, you may have a latent response of fibrosis, so that is something to bear in mind. If you think this might be useful for somebody, please share this video, because I am very much a one for trying to get the word out, because people don't need to suffer with this. It's a fairly easy fix. I say fix in a very loose term. We don't fix you, we just help you to fix yourself, really. We're just facilitators, that's all a physiotherapist is. We're trying to diagnose, work out what the problem is, and then offer up a solution that you really have to do the hard work for. We just do a few bits and pieces and put you on the right track. Any questions at all, you know where I am. Any comments about this, I would always like to hear your comments. Anything you want me to talk about in the future, or you'd like to know a little bit more about that I haven't discussed already in previous YouTube videos, then drop me a line. Take good care, bye.